Welcome to Pelvic Pain Month. I'm Dr. Alexa.
And I'm Dr. Julie.
And we are pelvic floor physical therapists. We are here to talk about why your patients aren't getting better and what you may be missing in your treatment plan.
When it comes to pelvic pain, so many clinicians will get overwhelmed because patients present not just with one, but usually about 5 or 6 different contributing factors. So we're going to look from what we call a whole body systems approach.
First system we're going to talk about is the nervous system. We're going to give you a hack for the nervous system as well as a hack for every other system we're talking about today to help calm the body and all the systems as one big full body approach. For the nervous system, we know that your brain and your pelvic floor are very much connected through the central nervous system. We have your brain and spinal cord coming all the way down, ending at your tailbone, which is right here where a lot of your pelvic floor muscles attach. As we know, the central nervous system, which we often talk about as the autonomic nervous system, parasympathetic, sympathetic, fight or flight, rest and digest, that is all connected in your central nervous system down to your pelvic floor. So we know that your pelvic floor muscles actually have receptors for those fight or flight and rest and digest receptors connecting to your brain. And so if you're always in a fight or flight mode, your pelvic floor is not going to be able to fully relax. The muscles are literally going to be contracted at baseline. And so no amount of work we do muscularly is going to get that fully let go until we tap into the nervous system. One way we can do that is through a nerve called the vagus nerve. Julie, what's the vagus nerve?
The vagus nerve is one of our cranial nerves, and it is the longest cranial nerve that exists in the body. Its job is to help automate and regulate that autonomic nervous system. So the vagus, which comes off the brain, travels all the way down through the chest, comes down even into the colon GI system, and takes us more into that rest and digest, which we want because healing happens there. So a quick, easy hack that we love to do because we want to teach patients what they can do on the go and integrate it through the day is something called sternal pressure. Go ahead and take your hand and put it right on the sternum. We want pressure in and a slight just depression right through that region. It immediately feels calming to the patient. This is where your heart is located. The vagus nerve, again, is running under the sternum through here and does innervate the heart. So this will decrease and calm heart rate, and it will help with better breath work because it helps regulate with breath. So take a diaphragmatic breath at the same time. As you do that sternal pressure, you may hear a few gurgles in the gut because, again, it comes down and innervates the gut. And this will prep your patient to be ready and receptive for when we go to the next step or phase pillar.
Okay, moving into the next pillar, we're going to talk about the musculoskeletal system. So within that system, we're looking at both muscle, which is in your actual pelvic floor. Your pelvic floor is muscle, but also all the connections from your pelvis up to your head and down to your feet. We know that fascia exists all throughout the entire body, and it wraps around the bones, the muscles, the organs, everything in your body, the nerves, the blood flow. So when we're looking at fascia and muscle, a lot of pelvic PTs tend to focus really only in the pelvic floor muscles. However, what's going on at the pelvis, at the center of your body, is affecting what's going on anywhere else in your body. So for today's example, we're going to talk about the foot and what we can do with the foot as a hack to help your pelvic floor.
So the foot connects to your pelvic floor in various ways. Number one, on the brain, through something called the somatosensory homunculus. The foot and the brain literally are next to each other. If we have a body map actually that's represented on each hemisphere. And so when your foot actually gets some love and is healthy, it influences what happens with the pelvic floor, okay, and all your genitalia. Number two, fascially, the foot actually has this fascia, the bottom of the foot, that connects all the way up through the back of your leg, up into the pelvic floor. Another line that's called our posterior fascial line or train, and another one comes spirally and through the midsection here. So if the fascia down here is super tight, it will tug and influence what's happening up at the pelvis. It would be like me taking this, Dr. Alexa, and tugging and pulling. So if the foot right here is tight, do you see how it tugs up on the shoulder? So this is the same principle that happens with the foot and the pelvic floor. All right, so let's go into a quick hack. What are we gonna do?
So we have this pinky ball, or you can use a lacrosse ball or tennis ball. And we're going to actually have the patient roll out their foot all the way down to the toes, pretty much 360, anywhere around the foot, even all the way down to the heel. In areas that might feel a little bit tenser or tighter or more painful, you can have them hang out and kind of work out a knot there. But you want them to do it for about a minute on each foot. And as a little test, you can have them reach and touch their toes before they do it and then retest after and notice how that connects all the way through.
Can we take a look at that hack really quickly in action?
All right, I'm going to do my pre-test and reach towards my toes and see how far I can go. And this is about as far as I can reach before I get stopped. And then I'm going to take the ball and roll all the way through just for 1 minute on each foot in an area that's really tense and really focus on that spot and see if I can get a release. Okay, I'm going to switch feet here. And notice the difference from side to side, different areas that might be restricted, and think about how that might influence what's going on left versus right in my pelvic floor here. And there's an area right there that needs to be released. I'm going to get rid of my ball here and see if I can get better range of motion. And now I can actually touch my feet, maybe even the ground. It feels actually a lot lighter all the way up my hamstrings and up to my pelvic floor. The third pillar we're going to look at today is the endocrine system. As a physical therapist, working with the endocrine system is still within our scope in the way that we're encouraging patients to go see the proper providers to check numbers and levels for all their hormones. Specifically, one that we look at a lot in pelvic floor health is the thyroid. And the thyroid is something that often gets neglected unless somebody has pretty significant symptoms.
Thyroid is a master endocrine gland. So you always want to ask your patients, what are your thyroid labs? Have they been tested and are they abnormal? So when the thyroid becomes hypothyroid, or you have an autoimmune issue such as Hashimoto's thyroiditis, it can be an underlying perpetuating factor to muscle spasm. That can be anywhere in the body or the pelvic floor. So please look at all these labs, request and follow up with your patients to make sure they are being monitored.
Our fourth pillar today is going to be the GI system, gastrointestinal system. So before we get started, go ahead and subscribe, hit that button below, throw some likes, and engage with our account. We're excited to teach you more.
Let's dive in.
We have a nice little apron here that we often wear when we're educating our patients to show them where everything sits in their body. So one thing that a lot of pelvic pain patients complain of is constipation. And a lot of times they don't realize that their constipation might actually have something to do with their muscular dysfunction or maybe their pelvic floor issues. One big thing I always remind my patients is that when you have constipation and your stool is stuck here in the large intestine or the colon, you're basically holding on to toxins all the time in your body, and it's not allowing your system to fully detox. Julie, is there anything else you usually ask your patients about when they're constipated?
Absolutely. I always want to ask, do you have any issues with your tailbone or your pelvic floor muscles? The pelvic floor has to be able to eccentrically release and elongate so the rectal and anal canal can expand and you can actually pass your stool. So one of the things I like to say is sometimes the train can arrive, but it cannot leave the station. Let's look at a hack on how patients actually can do a quick stretch to integrate through their day and through their home program to elongate and release the pelvic floor. And you as a clinician will have to remember you need to do a transanal and rectal exam and see what the pelvic floor is doing from the back door, as well as the position of the tailbone.
So one quick stretch or hack I give a lot of my patients is I actually have them rotate their hips internally, like you can see here, rather than being more neutral like this. When they rotate internally, it opens up the back of their pelvis a little bit better. So it can help them get that muscle, the anal sphincter or puborectalis muscle, which is right at that surface, to let go. And then they have the option of either sinking back almost like a rocking child's pose here, or they can actually stay back here, hold it, get comfortable, and then do some very slow deep breaths. So inhale and sending air to the pelvic floor, and exhale back to neutral for about a minute or two until they can feel that full release. Or again, they can move with it if it feels more comfortable to be moving. Our fifth pillar is the lymphatic system. Your lymphatic system is basically where all your toxins are being drained, right? You have lymph nodes and lymphatic vessels all through your whole body, but there's certain areas of your body where you have more concentrated amounts of those. And one of those is going to be in the neck, and another one's going to be in the armpit, And another one's going to be in the groin and pelvic floor. So we know, and even back to the back of the knees, right? So a lot of our patients, when we look at them in posture, we'll see these big pockets of swelling in those areas, especially in the back of their knees. And we know that they're just not getting those toxins flowing out. So in order to help patients with this, we often have them get some sort of compression garments or socks, but we also often have them do movement to help them feel better.
Let's show everyone a quick hack that we can utilize to get our patients moving and the lymphatics flowing. Twisting is amazing! Woo! Jumping, moving, any way you can. Woo!
So our sixth and final pillar is the urogynecologic system. We know we have pelvic organs that are intimately related to your pelvic floor muscles. One of their jobs is to support those organs. And so for a woman, that's going to be bladder, uterus, and rectum. And for a male, that's going to be bladder, prostate, and rectum. So today we're going to talk a little bit about a hack for your bladder and how we can help it empty better. Or if you're having pain with intercourse or actual pelvic pain, how we can let the bladder release better so that the muscles don't respond by contracting. So Julie, why don't we talk about our hack?
Super easy hack that, again, you can integrate throughout the day is a squat stretch. And so when we go into a squat stretch, we want to think about dropping all the way down like this. It's a full passive squat, like I am ready to pee in the woods, okay? And we want to take a couple deep diaphragmatic breaths to allow that pelvic floor to expand three-dimensionally, front to back, side to side, okay? And hold that for about 3 breath patterns or cycles. If you have a squatty potty at home, you can simulate the same thing on the toilet. Remember to never push your pee out. And so ask your patients if they are pushing their pee out, because you will be surprised how many people actually do. That hack actually could be used also for painful sex. Beautiful stretch to do before you're going to have sex.
And those are our 6 pillars. As a clinician, just be reminded all the time that your body or your patient's body is more than just their pelvis, and we have to address it from a system-wide approach.
All right.
All right.